Evidence-based practice, EBP, for 10th semester students of the Faculty of Medicine. Evidence-based practice, EBP, is a critical subject studied by medical students in their 10th semester. It focuses on integrating the best available scientific evidence, clinical expertise, and patient preferences in clinical decision-making. EBP serves as the foundation of modern medical practice, ensuring that interventions are based on the most current and reliable evidence. 1. Definition of evidence-based practice. Evidence-based practice is a systematic process of finding, evaluating, and applying scientific evidence in clinical decision-making. Its main components include 1. Best scientific evidence. Results from high-quality research such as randomized controlled trials, RCTs, or meta-analyses. 2. Clinical expertise. The experience and skills of healthcare practitioners in applying evidence. 3. Patient values and preferences. Consideration of patients' needs, expectations, and conditions. The goals of EBP are to improve the quality of healthcare services, reduce variations in clinical practice, enhance cost-effectiveness. 2. Steps of evidence-based practice. EBP involves 5 main steps. 1. Formulating clinical questions. Ask. Developing specific clinical questions using the PICO framework. P. Population, the population or patient being studied. I. Intervention, the intervention being considered. C. Comparison, the comparison intervention, if applicable. O. Outcome, the expected result. Example, in patients with hypertension, P. Is regular exercise, I, more effective than antihypertensive medication alone? C. In lowering blood pressure, O. 2. Searching for evidence. Acquire. Searching for scientific evidence from reliable sources such as scientific journals, PubMed, Cochrane Library. Clinical databases, up-to-date, clinical key. Practice guidelines from health organizations. 3. Appraising the evidence. Appraise. Evaluating the validity, reliability, and relevance of the evidence. Hierarchy of evidence. 1. Meta-analyses and systematic reviews. 2. Randomized controlled trials, RCTs. 3. Cohort studies. 4. Case control studies. 5. Case reports. 6. Expert opinions. 4. Applying the evidence. Apply. Integrating the best evidence with clinical expertise and patient preferences. Example, if evidence shows that a combination of exercise and diet is more effective for lowering blood pressure, the physician must consider the patient's condition before making recommendations. 5. Evaluating the outcomes. Assessing the effectiveness of the implemented intervention. Did the desired outcomes occur? Were there any side effects or complications? 3. Key components of evidence-based practice. Sources of scientific evidence. 1. Primary research. Studies that collect data directly from subjects, such as clinical trials and observational studies. 2. Secondary research. Analysis of data from previous studies, such as systematic reviews and meta-analyses. 3. Clinical practice guidelines. Evidence-based recommendations from medical associations or health organizations. B. Clinical expertise. Doctors must be able to use scientific evidence in complex clinical situations. Example: managing patients with comorbidities that do not align with standard clinical trial results. C. Patient preferences and values. Physicians must consider the patient's needs and expectations. Cultural, social, and economic factors affecting treatment choices. 4. Implementation of evidence-based practice in clinical practice. A. Applications in diagnostics using diagnostic tests with high sensitivity and specificity based on scientific evidence. Example: choosing mammography as a screening tool for breast cancer in high-risk women. B. Applications in therapy selecting medical or non-medical interventions that have been proven effective. Example: providing combined therapy, medication and behavioral therapy, for patients with severe depression. C. Applications in prevention applying evidence-based preventive interventions to reduce disease risk. Example: administering HPV vaccines to prevent cervical cancer. D. Risk management using evidence to assess and minimize the risk of complications or side effects. Example: determining the risk profile of patients receiving anticoagulants to prevent bleeding. 5. Challenges and solutions in evidence-based practice. Challenges. 1. Limited access to current evidence. Not all physicians have access to scientific journals or databases. 2. Time constraints. Reviewing and analyzing evidence requires time that may not always be available. 3. Lack of training. Not all practitioners are trained to evaluate scientific evidence. 4. Resistance to change. Physicians or institutions accustomed to traditional methods may be reluctant to adopt EBP. Solutions. 1. Education and training. Providing training on how to search for and evaluate evidence. 2. Use of technology. Clinical applications based on EBP, such as UpToDate, make accessing evidence easier. 3. Team collaboration. Relying on multidisciplinary teams to share information and support evidence-based decision-making. 6. Role of evidence-based practice in the 10th semester. A. Theoretical learning. Students learn the basic concepts of EBP, the hierarchy of evidence, and techniques for evaluating evidence. They are taught how to formulate relevant clinical questions and search for scientific evidence. B. Practical training students participate in clinical case simulations based on EBP. They analyze real-life study data to make clinical decisions. C. Evidence-based research students conduct mini-research projects based on EBP, such as systematic reviews or meta-analyses. D. Application to patients during clinical rotations. Students apply EBP under the supervision of mentor physicians. 7. Conclusion evidence-based practice. EBP integrates scientific evidence, clinical expertise, and patient preferences to improve the quality of healthcare services. In the 10th semester, medical students study both the theory and application of EBP to prepare them for complex clinical challenges. By applying EBP, clinical decisions become more accurate, effective, and relevant to patient needs, contributing to the progress of modern medicine and the enhancement of population health.